of these four major neurotransmitters: serotonin, norepinephrine, epinephrine, and acetylcholine. After 3 months on the supplement, they all normalized. I find that absolutely stunning, just absolutely stunning. All five major neurotransmitters, we were very excited to see great improvements. The supplement greatly increased urinary excretion of cadmium and tungsten and slightly increased excretion of thallium, which I wasn't expecting. It's not present in the supplement. We've checked that carefully. And so it does appear that it's indirectly helping get rid of these toxic metals, perhaps in part because it reduces glutathione, but that would be an indirect effect because glutathione is excreted in the stool, not in the urine. Parent global impressions results. This is just a very simple form as we used in our first study because we found it was very sensitive. We asked the parents, did your child get much worse or much better in these different measures? So the red is the supplement group, the blue is the placebo group. So again, this shows a strong placebo effect in almost all areas. And that's why it's so important to do a double-blind placebo-controlled study. So for example, with expressive language, we saw good improvement from the placebo group, but even more improvement for the supplement group. Well, over 3 months, we hope the kids will be making some small gains. Well, we hope for large gains, but they'll make some. And so in every area that we looked at, every area on this form, the supplement group did better. Some of those were statistically significant. The last number on the right is the average. So averaging all of those numbers, we then come up with this average value. So I'll now show you the data for those who like numbers and p-values. The major differences were hyperactivity was statistically significant improvement in the supplement compared to the placebo group, p of 0.001, improvement in tantruming. And I think both of these probably relate to improvement in neurotransmitters. If you can improve neurotransmitters, you're probably going to have a calmer child, you're probably going to have a less hyperactive child. That's a hypothesis. That's my guess. Overall improvement, p of 0.04. If you look at the total, if we sum all of those values for the improvement for the placebo group, the total is 4.0. The total for the supplement group, 7.5. Statistical significance, p of 0.01. So overall, it looks like the supplement helped in many different areas. Some statistically significant, some marginally statistically significant, some suggestive but not significant. You know, if I can give a child a simple vitamin supplement for 3 months and see any benefit, and we've now had some children who over a year have nearly recovered. Again, I have to say that it's not a formal study, but it's just very powerful to see that just a simple supplement can have that sort of benefit. It's not, these supplements may run for order $100 a month depending on the child, but that's not much to pay for giving any benefit. But it's an easy thing to try and observe a child for a few months and see. And exceptionally safe. Again, no one dropped out due to adverse side effects. The side effect profile was really pleasing to see. And the one child who was at 10 times the dose by mistake gives us a lot of safety, a very good feeling about the safety of the supplement. Other questions?